I'm Maureen May, a registered nurse of over 40 years. I am also the president of PASNAP, the Pennsylvania Association of Staff Nurses and Allied Professionals. We represent over 11,000 healthcare workers and nurses across the state of Pennsylvania. I'm here with members of our statewide executive board to talk about the decision that Congress is making right now. This will directly affect whether Pennsylvanians can afford health care insurance or whether hospitals across our state will stay open. At the end of the year, in just 3 weeks, the Enhanced Affordable Care Act premium tax credits are set to expire. If Congress votes to allow that to happen, health insurance premiums will double for many working families in Pennsylvania. People will see increases of hundreds, if not thousands of dollars more a month for their health care coverage. Many will have no choice but to drop coverage entirely. Already, many thousands of people across Pennsylvania have already dropped their coverage. This is not a Democratic or a Republican issue. Whatever district you live in, we all want affordable health care, and we want our hospitals to be funded.
Hello, my name is Robert Bozak. I've been a critical care nurse for over 16 years. Pennsylvania Health Insurance Exchange estimates that if the ACA subsidies are not extended, 150,000 Pennsylvanians will lose their insurance. As a nurse, I want to be very clear about what that means to you. When people lose insurance, they don't stop getting sick. They delay care. They skip medications. They wait until problems become so bad they become emergencies. The care doesn't disappear. It moves into emergency rooms in hospitals, where they become more expensive, more dangerous, and most of the time unpaid.
My name is Debbie Bozeman. I have been a medical surgical trauma nurse since 2013. At the same time Congress is debating whether to extend the Affordable Care Act tax credits, Medicaid cuts have already been approved to go into effect next year. Hospitals in Pennsylvania are currently underfunded. Medicaid reimbursements already fall significantly short of the cost of care, and that gap will grow even larger with the planned cuts. Hospitals are being forced to make impossible decisions. And in our hospitals, we're already seeing the warning signs. Beds are closing. Units are shutting down. Hospitals are being sold or consolidated. When a hospital closes, a community loses more than a facility. They lose emergency care. They lose maternity services. They lose behavioral health care. They lose jobs and economic stability. This is how healthcare deserts are created. And once access is lost, it's incredibly difficult to restore.
Hello, my name is Phyllis Brown. That is why failing to extend ACA tax credit right now is so dangerous. ACA credits aren't a bonus, they're a stabilizing force, especially while Medicaid funding is also being cut.
I'm Peggy Malone. I'm a registered nurse for 37 years. We are urging Congress, Republicans and Democrats alike, to act now, extend the Affordable Care Act premium tax credits, protect our patients, and protect our hospitals. This is about access to care. This is about hospital stability, and this is about preventing a crisis that is already taking place. Because when coverage is lost and hospitals close, every single one of us pays the price.